Hello, it's Dr. Gabe from First Sec MRI, and this is a young gentleman who came in with complaints of right hip pain. His orthopedic surgeon ordered an MRI scan, and on the MRI we noticed this. This is the femoral head, and below the articular surface there is a classic sign of avascular necrosis, this well-defined, sharply defined band of low signal with a serpiginous course here. This is classic for AVN or avascular necrosis, and avascular necrosis is usually beneath the articular surface. Eventually it can lead to collapse of the articular surface. This is a sagittal view where we see the AVN here, this serpiginous band of, this is hyperintense signal on this beneath the articular surface, but it's not collapsed yet. Here the brightness here, this is really prominent marrow edema, and we see fluid in the hip joint here. And this is the same view over here where we see fluid in the hip. So avascular necrosis advanced, but luckily no femoral head collapse yet. So the orthopedic surgeon decided to go in and do a core decompression. So they'll put a core device in here and take out a piece of bone, and that will hopefully help the body heal itself. It'll allow decreased pressure and allow blood, a new blood supply to come in here and hopefully vascularize this avascularized portion of the femoral head. And the patient did get that procedure, but the pain persisted, so they came back a month later with unrelenting pain. We can see here where they had the core decompression, and we note that the marrow signal had not gone down. Sometimes right after surgery can be just as prominent or more prominent, just related to the surgery, but this is definitely more extensive. It goes down into the humeral shaft down here. Also the fluid, instead of being clean like on the original examination, there's a moderate joint effusion, but the fluid looked very uniform and clean. And on the new examination, the fluid is irregular, it's heterogeneous in signal, so it looks like severe inflammation, prominent synovitis or synovial inflammation. And also the acetabulum here before, the roof and the medial portion look nice and normal. On the current examination, the roof is nice and low in signal, but along the medial margin here it's bright. And so this is worrisome for infection, osteomyelitis. So it looks as though this patient has developed osteomyelitis, an infection that is all through the femur, gone into the joint here. The joint has really severe synovial inflammation, so it looks like a septic arthritis. And it looks like the infection has also seeded this bone here, the medial acetabulum. Also, we can see the prominent edema in the muscles. These are the deep muscles of the pelvis over here. So it looks as though there is a complication related to the surgery of osteomyelitis with septic arthritis in this patient who had a core decompression. Thank you very much.